Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today we are discussing Huntington's disease, a condition often described as one of the cruelest diagnoses in all of neurology. Because there are currently no treatments that stop or slow its progression, clinical care focuses entirely on managing symptoms and protecting a patient's daily quality of life.
That exact reality is why Huntington's was included as an original qualifying condition under Pennsylvania's Act 16 back in 2016. As we detail on our site at PennsylvaniaMarijuanaCards.com, the biological connection between Huntington's pathology and the endocannabinoid system is actually among the most compelling in neurodegenerative science.
Let's unpack that biological connection, because this isn't just a generic marketing claim. What is physically happening to the cannabinoid receptors in the brain of someone with Huntington's?
It is a profound neurochemical shift. In a healthy brain, CB1 receptors are densely packed inside the striatum, acting as a critical brake to suppress excessive glutamate and prevent toxic cell death. But when Huntington's takes hold, one of the very first measurable biomarkers is a dramatic, widespread destruction of those CB1 receptors. Essentially, the disease actively dismantles the exact system that medical cannabis targets.
That is an extraordinary scientific link. Now, let's look at the actual clinical trials, starting with Chorea, the involuntary dance-like movements that most people associate with Huntington's. What does the human data honestly say about cannabis treating these motor symptoms?
The clinical trial landscape is mixed, and we believe in absolute honesty with our patients. Early controlled trials showed that CBD alone did not reduce chorea. However, studies using CB1 agonists, meaning THC-active compounds like nabilone, did show statistically significant improvements in chorea severity subscales. It isn't a magic cure for total motor scores, but it has proven to be an effective tool for calming those involuntary movements in multiple crossover trials.
Thank you for that honest distinction. But Huntington's impacts far more than just movement. Let's talk about the psychiatric and behavioral domain. Things like severe irritability, depression, anxiety, and sleep disruption. How strong is the clinical case there?
In daily practice, the case for behavioral management is arguably the strongest. These psychiatric symptoms often surface years before motor decline and cause massive distress. In the nabilone trials, behavioral indicators like severe irritability and agitation improved significantly. Furthermore, modest, controlled doses of THC before bed reliably help overcome the severe sleep fragmentation caused by constant nighttime movements.
There's also a major physical benefit highlighted in your guide regarding weight management. Huntington's patients face a severe risk of malnutrition due to the massive caloric burn of constant involuntary movements.
Exactly. Rapid, dangerous weight loss is a severe complication that directly correlates with worse clinical outcomes. Because THC powerfully stimulates the endocannabinoid pathways responsible for hunger, it stands as one of the most reliable appetite stimulants available. For an HD patient struggling to maintain their body weight, this practical benefit is absolutely vital.
That makes total sense. Now, if you read preclinical research, there's a lot of exciting talk about neuroprotection, the idea that cannabinoids might actually slow down cell death in the striatum. What is the crucial caveat that patients and caregivers must know here?
We must be explicitly clear. All neuroprotective data for Huntington's is strictly preclinical. While a recent 2025 review out of the University of Toronto confirms these multi-layered antioxidant and anti-inflammatory mechanisms work beautifully in cell cultures and animal models, no human clinical trial has ever proven that cannabis slows down the actual disease progression. It is an amazing area of research, but today, cannabis must be viewed strictly as a symptom management tool. Keeping that clinical framing accurate is exactly why patients trust our practice. Let's talk about specific product safety, because Huntington's causes progressive cognitive vulnerability. What are the strict dosing rules for these families? Because high doses of THC can worsen disorientation, memory impairment, or gait stability, we advise a strict start low and go slow approach. For motor symptoms and appetite, low-dose THC-dominant oral tinctures or sublingual oils are preferred, especially since swallowing capsules can become difficult in advanced stages. For pure anxiety or irritability, balanced ratios are safer. And high THC products should be completely avoided if a patient has any history of HD-related psychosis.
Outstanding safety guidance. So if a family or a designated caregiver is ready to pursue a state certification through our telehealth clinic, how can they get started? We've made the process incredibly seamless and entirely remote. Step 1 is filling out our 3-minute online pre-qualification form at PennsylvaniaMarijuanaCards.com. Step 2 is your private telehealth consultation via video. You'll consult directly with a state-registered physician, like Dr. Jonathan Chance Miller. His official medical license credentials and NPI number are fully transparent and listed right on our homepage for complete peace of mind. And your practice maintains that same strict protective policy if our medical team reviews their neurology records and determines that cannabis isn't a safe fit for their care plan. There's no financial risk.
None at all. If our physicians find that cannabis poses a safety risk alongside their current prescription medications, or that they do not meet the state's clinical criteria, their $159 evaluation fee is fully and immediately refunded. If approved, Step 3 is automatic. We file the state certification that very same day. We also walk families step by step through the state's caregiver registry so a loved one can legally handle dispensary visits and dosing administration on the patient's behalf.
Comprehensive biological education, strict safety protocols, and zero financial risk. An extraordinary lifeline for the Huntington's community.
Absolutely. If you or a loved one are ready to explore medically guided relief for Huntington's-related movements, anxiety, sleep issues, or weight loss, visit PennsylvaniaMarijuanaCards.com. Fill out the form at the top of our page and let our dedicated medical team take care of your family.
Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thank you for listening, and take care.